And we have breaking news now out of Manitoba, where a surge in COVID cases is pushing the healthcare system to the limit. The province has asked the federal government to send the military and potentially dozens of intensive care nurses to help cope with a growing backlog. CBC's Riley Laychuk is in Brandon right now. Riley, give us a sense of what hospitals are experiencing and what they need to make it through this wave.
Well, simply put, Asha, the province is asking for resources, more people to staff intensive care units here in Manitoba. As you mentioned, the province has put in a request with the federal government with Emergency Preparedness Minister Bill Blair. It is looking for another 15 to 30 ICU nurses to help staff hospitals here for 6 weeks. Now, this request went in over the weekend and comes as Manitoba continues to deal with a strain on hospital staff and resources. Now, to give you a sense of where things stand, as of this morning, there were 102 patients in Manitoba intensive care units. Pre-pandemic, there were only 72 ICU beds in the entire province. In the past week alone, 22 people were admitted to Manitoba ICUs for treatment of COVID-19. Now, this has caused the province to redeploy staff and cancel some surgeries and procedures in order to free up ICU nurses and beds.
And I can only imagine the stress right now, the tension. What are doctors and nurses on the front lines saying about this?
Well, more help is something that doctors have been asking for. In fact, over the weekend, 10 Manitoba doctors penned a letter to Premier Heather Stephenson asking for the military to be called for help and for the province to crack down on people who are breaking public health orders. Now, I mentioned surgeries and procedures being canceled so staff can be redeployed to ICUs. The doctors in their letter said that redeployment is causing a huge surgical and diagnostic backlog, which is interesting because just last week, the province struck a task force to try and get a handle on some of the long wait lists for surgery in Manitoba right now. Now, one of the signatories on that letter was Dr. Gillian Horton. She is an internist at the Health Sciences Center in Winnipeg. Here's a little bit of what she had to say.
I think what's important for people to understand is we are dancing around zero capacity every single day. Like all complex situations, it's fluid and dynamic, but really there is no more buffers.
Now, we have reached out to Minister Bill Blair's office as well. In fact, we just heard back from his office in the last hour. The ministry says Manitoba can expect a response to its request for more ICU resources within days. Asha?
All right, check in with you again soon. Thanks, Riley. CBC's Riley Laychuk in Brandon, Manitoba.